Hello and welcome. Today I'll be speaking on nosebleeds. Should I be scared? Usually not, but sometimes you may need to go to the hospital. People, or some people, can literally be scared at the sight of blood, let alone blood coming from the nostrils. Epistaxis or epistaxis is bleeding from the nose. Why does this occur? When there's rupture of blood vessels in the nasal mucosa, blood will come from the nostrils. In most cases, it's innocuous, nothing to worry about because it will resolve spontaneously. However, there are situations where you need to be in the hospital to get it resolved. Let's talk about a little anatomy of the nose. At this point here, we have the nasal septum that separates or divides the right nose from the left nose. And then at the bottom part, just somewhere close to that point, is what we call the Little's area or Kesselbach area. The Kesselbach plexus is a vascular network which supplies blood to the lower front of the nasal septum. And guess what? That is the area we tend to pick when we pick our nostrils. And bleeding usually will occur from there. Most times, blood will come or bleeding will occur from one nostril and not both. So what are the causes of epistaxis or bleeding from the nose? Number one, picking the nose, particularly when it's dry, blowing your nostrils or your nose too hard, when it's cold or when you have a cold, usually when you have a cold, then trauma, for example, boxers or after a fall, or when people engage in a fight, use of illicit drugs such as snorting cocaine, bleeding or blood clotting disorders such as hemophilia, and then coagulation problems or disorders such as thrombocytopenia, that is when the platelet count is low, or another condition called von Willebrand's disease, which I'm not going to explain in this video. Medications such as anticoagulants, patients on warfarin, or antiplatelets, patients on aspirin. And then when patients have cancer such as squamous cell carcinoma, and then high blood pressure. What can you do? The question is, should I be scared? I said, no, but sometimes you may need to go to the hospital. So why shouldn't you be scared? Because there are things you can do. Number one, don't panic. And that is maybe easier said than done. But truly, don't panic. And you see why. If you're bleeding from the nostrils or from your nose, the first thing to do is to sit down and lean forward and head tilted forward, your mouth open, slight pressure, apply some pressure to your nostrils with your thumb, your index finger, apply that pressure just somewhere around there for about 10 to 15 minutes. The reason why I've said you shouldn't panic is that if you panic, you run into a situation where after applying the pressure there, you will keep checking to see whether it's still bleeding, and by so doing, by releasing the pressure, the bleeding will continue. So number one, don't panic. Number two, sit down and lean forward with your head tilted forward and your mouth open. Of course, you need to breathe through your mouth this time around. Apply pressure there and hold for about 10 to 15 minutes. Usually, the bleeding will stop. However, there are situations where you need to go to the hospital. Number one, if the bleeding is profuse. Number two, if you're bleeding from both nostrils. Number three, if the bleeding sites cannot be identified easily when examined. These are reasons for which you should go to the hospital. The specialist that is primarily trained to address bleeding from the nose will be an ear, nose, and throat doctor or surgeon. And there are a number of things that can be done, one of which will be nasal packing. Number two, they could carry out a procedure called cautery or cauterization, where they bond the irritated blood vessels so as to seal it up. If these measures are carried out, usually that should be adequate. If you have recurrent epistaxis, recurrent bleeding from the nose, it will be important to find out the underlying problem. I've listed a number of causes. It's important to identify which of these is responsible. And then after the bleeding stops, it's important that over the next 24 to 48 hours, you don't pick your nose, else you can trigger another round of bleeding. In this video, we've learned what epistaxis is, which is bleeding from the nose, and what you can do to ensure that you address the problem, and if the bleeding is profuse, when you need to visit the hospital. If you've learned something, like, share, and subscribe. Thank you.